Friends, I am Dr. Sujit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 8 homeopathic remedies for aphasia. What is aphasia? Aphasia is in fact a symptom, not a disease, which shows difficulty in verbal or written communication. It can affect speech, writing, realizing words. Generally, it arises from brain stroke or brain tumor. That is, from brain, the speaking, speech, writing and realizing words, everything is in jeopardy, in trouble. This is aphasia. Primary aphasia means loss of word, loss of speaking power, but it also includes writing, realizing words also. What are types of aphasia? This describes how well a person can understand what others say, and also describe how well a person can speak or correctly repeat what someone says. The aphasias are of different types. If you have been name given here, Broca's aphasia, conduction aphasia, Wernicke aphasia, transcortical aphasia, mixed aphasia, global aphasia, others. These have been given just for interested persons who want to know the types of aphasia, but the details are beyond the scope of this discussion. If you want to know details, then you have to search internet. What is Broca's aphasia? What is conduction aphasia? You can, if you have got interest, you can see. But if I go to describe this, most of the viewers will feel bored. So I have not given it so much. Just for interest, few name. Aphasia may develop also slowly over time. That is, there may be sudden aphasia or slowly coming disease. Many people may have aphasia that cannot come under above types. Also, there are other types. Strictly speaking, each person with aphasia may have unique sign symptom. This is very much peculiar symptom. Unique sign symptoms. If there is unique sign symptom, then you cannot group that. Unique means every individual has got his special sign symptoms, strength, weakness, rather than a particular type. So many aphasia cases cannot be grouped under this name, what have been given here. What are common signs and symptoms of aphasia? Speak in short and incomplete sentences. Speak in sentences unintelligible to other normal persons. Speak unrecognizable words. Face difficulty in finding words. Write sentences that do not make sense. Cannot follow others' words. Cannot understand what they read. Note the signs and symptoms of aphasia. If you think that aphasia means just speaking trouble, it's not that. So many different trouble are included in aphasia. What are causes of aphasia? As already mentioned, aphasia is not a disease, rather a symptom of some other disease like brain stroke and brain tumor or injury to brain. Actually, brain. Some portion of brain is affected, the portion which controls the speaking, realization, word fetching, etc. So many things of intelligence relevant to speaking. So like brain stroke or brain tumor or injury to brain, in some way or other, part of brain is always involved here. That is, aphasia cannot come without trouble of brain. There must be some brain trouble. What are risk factors of aphasia? Head injury, brain tumor, infection in brain, degenerative process in brain. What are complications of aphasia? Loss of fluency in speaking, mutism. Mutism means just mute, just become mute, that is, speaking stopped. How can aphasia be prevented? Lowering chance of cardiovascular disease, there is regular workout, minimizing intake of saturated fat, like these things, various exercises, simple exercises, protecting head from injury, that is, if there is probability of getting head injury, after wearing headgears so that there will be no injury. Discussions about treatment of aphasia with homeopathic remedies. Lycopodium for aphasia. Subjects intellectually keen but physically frail. Fear to be alone, yet avoid company lest they disturbed them. First they means the persons, and last they means patients. Problem was during 4 to 8 p.m. That is a characteristic of lycopodium. Like foods and drinks warm, sleep with half open eyes. You have to employ lycopodium 12 or 36 hourly. On the right hand side, the sleep with half open eyes has been shown. Mind this is a very, very strange and what should I call? This is a strange and very key symptom, most key symptoms of lycopodium. Sleeping with half open eyes. This single symptom can direct one to select lycopodium. Or a mate for aphasia. Patients suffer from depressive melancholy. Depression and melancholy combined. Constantly dwelling on committing suicide. Suffer from self-condemnation. If you employ Aromat 6 3 hourly. Carbovage for aphasia. Patients want heavy fanning over face. This is carbovage characteristic. Always weak, sick and exhausted. Suffer from flatulent dyspepsia. Body cold to touch. Pulse intermittent, thready and imperceptible. You have to employ carbovage 38 hourly. Acid nitric for aphasia. Urine very pungent and strong smelling despite drinking water sufficiently. Ulcers in mouth or gums. Sleepy. Feeling better on lying down. Suffering from some chronic diseases which would take cold easily. I mean the patient actually. Suffering from chronic diseases, patient take cold easily. Sulfur for aphasia. Either complete loss or excessive longing for food. There is loss means loss of want of food, or too much longing for food. Great desire for sweets, milk disagree, bitter taste in mouth in the morning, drink much, eat little. Sulfur symptom. Patients like to be bare-bodied. Sulfur patients always like to be bare-bodied. They do not tolerate any covering over their body. Give sulfur 1 ml, just 2 doses. Tuberculinum for aphasia. Symptoms ever changing. Tuberculinum symptom. Tubercular patients, the tubercular patient's symptoms change almost always. Take cold easily without knowing how and from where. Feeling better in every way in open air. Fear from animal, especially dogs. Most important tuberculinum symptom. Great craving for sweets. Give tuberculinum 200, just 2 doses. Netamur for aphasia. Every discharge from body acidic. Symptom worse in daytime. Map tongue with insular patches on the tongue actually. Cannot tolerate consolation. If you want to give consolation to Netamur patient, they will vehemently get angry. Sensitive to table salt. That is, either they want table salt more or they do not want at all. That is sensitivity. Either want the same too much or do not want at all, or rather does not want at all. 1 ml, 2 doses. Phosphorus for aphasia. Burning sensation all over body. Sweat smell like sulfur. Great fear of darkness. Often suffer from sour taste or irritation. After every meal, huge belching. Phosphorus 1 mg, just 2 doses.